the number of deaths as well as the number of admissions to hospitals, it seems like things are leveling off, at least in the areas where there was a high count. So New York City is one of the tri-state area is one of the areas. Clearly, the Midwest, whether it's we're talking about Detroit, the rest of the state of Michigan, in Florida also the numbers that were expected in California. So I think that there is a sense that the whatever we're doing is working and may actually allow us now to, in a very stepwise, very calculated way, get back to an operating economy.
Is there any way to determine what exactly, and I know it's not going to be one thing, but maybe in a pie chart, is there a way to determine what worked and to what percentage you can attribute how it worked?
Those who are the proponents of social isolation and shutting everything down are going to claim that that's the victory. You know what? That's fine. This is such a devastating event that anything that can get us back on track, excuse me, whether it's the only thing to do or whether the other option, doesn't matter, because if this is working, we'll take it. And we'll give them whatever credit that we can. But as you remember, we talked about this, there are different theories about what to be done. The problem is we don't completely yet understand the full behavior of this virus. That's one of the major issues. And two, we still haven't evolved in terms of being able to test everyone who's going back to work. Or patients who are coming to a hospital now to have other things done, which, going back to the old elective surgeries and other treatments. So that's still an issue.
All right, well, let's look at two things that you just brought up, and we can work in reverse. As far as the testing is concerned and still the need for testing, I see this as a big back and forth source of conversation on social media and beyond, which is, well, we can't have as many positive cases as we continue to see day in and day out and not have the available testing. So where is there a disconnect, if there is at all, in people at some point, you would think, returning back to work, but as you mentioned, not having the adequate testing?
So we need to have the testing available on demand. Okay, which is not the case, number one. Number two, we also need testing that has a high predictive value, meaning that the number of patients who test negative and yet have the disease is very, very small. And the number of people who test positive and don't have the disease is also very small. So we need that predictive value. We do have it with the current PCR testing, but it does take time. So what we're looking for is to get a high predictive value, have tests available on demand, right, and have the results returned within the most, we're talking about a couple of hours. So we're moving towards that, but we're not there. And to get people back to work, you have to be concerned about the fact that who's coming back to work. So if they come in and you could swab them and send it to the lab across the street, and it takes 2 days to get the return, it's just going to be an impossible logistic situation. And by the time 2 days pass, you don't know the exposure of that individual anyway. So they may come back and have to be retested. So the testing has to narrow in terms of when you get the sample to when you get the result.
Are we seeing anywhere in the world, even if it's not a specific country, but areas, or maybe it is down to a specific spot, where immediate returns on testing is actually working?
Again, it may be. We know that some South Korea, they have what's called point of care testing. The problem again is you can have results quickly, but if the results have a low predictive value, then the fact that you're getting them quickly and now having to deal with a low predictive value is another conundrum. So we're looking high predictive value, and again, high availability, and to very quick turnaround time. That's going to be the ideal, and we're getting there, by the way. I think that there are some companies now that are going to be able to do that, Abbott being one of them, just to mention one of a few, where they're trying to get this to be a very, very quick turnaround time. So the other, of course, is capacity. So if you're going into a hospital where multiple people are ill and coming in on a daily basis, you need to be able to throw these tests into a place where they can handle hundreds of tests or even thousands of tests a day. So that's the other problem with some of the testing, is that they can't manage large number of samples.
Is that a big enough of an issue to continue what we're doing, or can you work around that by quasi reopening up some sort of society, even if it's to benefit a couple of economic sectors?
Um, there may be, it's a good question. So there may be some sectors within the economy who will do okay if the number of individuals that they're normally used to is still going to be significantly restricted, versus being able to manage a larger volume of people that is controlled in a way that is protective of the rest of the population. So whether it's restaurants or any other example, um, if you limit the restaurant that normally houses 100 people at their dinner, and now can only say have 15 or 20, they're in business, but I don't think they're going to be able to really survive under those circumstances. So you want to be able to get back to as much of the old, I guess, economic level, okay, that there was, or as close to that as possible, for them to again recoup any kind of profit. So it's a complicated question, and I don't know whether there are some areas within the economy who can actually do well under these circumstances.
There isn't a way, though, to, it looks like, at the very least on the surface, there isn't a way to just go from coast to coast to north to south in this country and say a universal way to return to life. And even if it's not normalcy, but just back to life. So when you look at where we are, and you mentioned that you still don't know the full behavior of the virus, and we look at where we are, as you just laid out, from testing, how much sense does it make, knowing that you can apply variables like Des Moines, Iowa is different than downtown Brooklyn? How much sense does it make to look at this on a sliding scale, if you will, and say, well, sure, some areas can reopen, some can't, versus full behavior of the virus unknown, inadequate testing is still reality, might equal everybody stays locked in for another 4 to 6 weeks?
So I think that there is a significant and enormous pressure to reopen the economy. There's no question about that. And as you hear from protests, that some people say, the virus to me is a risk. I'll take it. I want to be able to have some kind of a income. We understand all of these issues. The issue clearly, in terms of stepwise, is what you want to do is open things in a controlled way. So the testing is essential to identify those people who may be infected but not symptomatic, or coming into a large gathering of individuals, whether it be a hospital or whether it be a restaurant or any of that, or a sport event, right? So you need that testing. What also would help is that if this virus can reinfect people, right, and you have the appropriate testing, you can actually then determine if there is a new hot area that's developing, and then close that down so you don't get it. So all of these logistics clearly do not allow for tomorrow us saying, everybody get out in the street and go and do what you need to do. If we believe that the social distancing and the fact that people stay at home, meaning shutting down the economy, has helped, which we think, looking at it today, probably did, or mostly did. So opening back the economy is a risk because there are two things. Number one, if we end up with the same type of surges that we've seen in the past few weeks, we may not be able to contain that again. So I think that as much as there's pressure to open the economy, it has to be first done in a very planned and logistic way, no matter where you are, whether you're in Des Moines or whether you're in New York City. But with the pressure on everyone to open the economy, I'm hoping that people will come up with some kind of, for a local plan
Right.
that makes sense, which hopefully at that point will also give us better testing.
So let's end on this, and we opened up a little on this, and we could kind of get a little bit deeper here as we wind down. It appears outside of the benefit or end game of opening up the economy or keeping it closed, not from an economic or political, but from a medical standpoint, it seems like from last week to this week, we have as good of a margin of good news as opposed to where we've been in previous weeks. It seems as if, right, from a standpoint, even if it's just passing peaks, that this is more of a positive tone than maybe in weeks past.
Absolutely. But if you recall our conversation, going back, we talked about weeks, right? A number of weeks where this is going to, again, wade or subside. Now, if we let off our guard at this point, there is concern that we may see again a second wave, which happened, by the way, in the 1918
And the
pandemic.
flow, right?
So we're very cautious about that, and it doesn't mean that we're not optimistic, because I agree with you. I think that the reports that are coming in are showing that we're sort of on a downslope right now. The question is, how long will it take for this downslope? It really doesn't matter, because if there's a continuous slope, it will allow municipalities and states to look individually at how they can open their economy and move slowly forward. But there's clearly a silver lining that we're seeing in all the areas.